Dan Matlow from VitalHub joining us on SmallCapPower right now. Dan, thank you for your time.
Thank you for having me.
Dan, talk to us about your technology platform. You are developing these SaaS-based healthcare solutions. What is that all about?
Yeah, VitalHub is focused on the healthcare sector with a primary focus on the mental health and the long-term care space that we have. So we're a combination of some acquisitions that we've made. We've made 4 acquisitions to date of electronic health records that all have a SaaS-based business model for helping mental health hospitals and community centers automate a lot of their processes. So mental health facilities, primarily they treat patients using what we call assessment-based technology. So they'll do assessments on the patients to determine their clinical appropriateness for being in that setting and the care plans that get associated with it. So they're complex assessments. They use international standards. So we computerize all those processes and we store them and we data mine them and they use those in the care of the patients.
In terms of the healthcare sector today, the market, what are the challenges that for you as a technology provider is an opportunity?
The biggest client that our customers are asking for is interoperability. They're asking for those mental health records and those assessments to be interchangeable amongst organizations. So they tend to be used in community mental health or hospital settings or in doctors' offices, but the real challenge now is that they've digitized them, they got it through paper, but how do we share those? What do we have to do?
So who are your customers? Who do you target as your audience?
So traditionally our customers have been those individual organizations, but what we're focusing on is innovative blockchain technologies to bring those together. So we've developed a blockchain solution on the Hyperledger platform that integrates mental health records so that they are interchangeable amongst all those organizations.
Until now, what's been the response like from the industry?
This is a huge problem. Statistically speaking, in the emergency room settings, anywhere between 15 to 25% of the patients in those settings are mental health patients. They cannot be serviced by those particular hospitals because they don't have the records. So we're providing a really interesting, innovative solution to get those to them.
You've been pretty aggressive in terms of your mergers and acquisition strategy. Any targets on your mind in 2018?
Merger and acquisitions that we've done 4 to date. We have $7 million in revenue after a year. We plan to continue going down that path. They have all been accretive, all in the same space. So far they've been focused in the Canadian marketplace and there's still others in the Canadian marketplace. We're starting to look across internationally. We're looking for those markets that we can go after and then innovate and put our blockchain technology on top of that.
What have been the synergies of the recent mergers that you've gone through? What have they added to your portfolio?
They're all excited. They're all smaller companies that have come together to form something big. They're innovators, but they're looking to get growth in size. So we're integrating them right now. We've got a happy family that's starting to come together, and they really want to be a force in the marketplace. So we're excited to bring them all together.
At Cantech, we're seeing so many healthcare tech players. How are you differentiated from the others?
I think we differentiate in many different ways. Number one is you have a team that's all done this before. So we are healthcare operators, going back to myself, 30 plus years of experience. We have proven customers, we have proven revenue, we got proven technologies, and we've been them before, and now we have a really innovative blockchain-based solution for hockey stick growth. So I think we're a real player. We're not just starting from scratch on this, and we got some big potential to grow.
And lastly, what should investors expect from VitalHub in 2018?
They should expect to start seeing acquisitions that keep continuing to place, and they should start seeing growth in revenue, and they should be really looking at the margins that we're starting to produce. It's real high margin type businesses. We have a history of moving internationally before. We explained to do that before. We don't believe the Canadian marketplace is big enough for the public market, so what we want to do is send signals that we got distribution channels, working and showing that we have customers that use blockchain, that have it implemented where it works. We want to be first to market in those particular markets. We want to partner with some big organizations. We already announced a partnership with TELUS last week with $1 million deal, and we plan to continue to do more of those.